If you're suffering with chronic pain, there are times when you probably hurt in so many places that you can't decide where you hurt the most. And at the same time, you may also have breathing or digestive problems, headaches, and even problems with your balance. You're probably wondering how you could possibly have so many different ailments all at the same time, and why is this happening to you? You've probably been to a variety of doctors and received multiple diagnoses, such as chronic pain syndrome, chronic fatigue syndrome, or even fibromyalgia. At first, receiving a diagnosis can be a bit comforting. At least now you know that your problem has a name. But when you ask, what is the cause of this problem, this syndrome, your doctors will probably tell you that it's arthritis, multiple injuries, exposure to toxic chemicals, or even poor nutrition, old age, or bad genes. Your doctors may even tell you that they don't know the cause of your pain, or that maybe it's all in your head. A young woman recently came to me with a similar experience. For years, she suffered with tightness in her neck. Then she started having pain that comes and goes in her feet and low back. She saw many doctors, but no one could find the cause of her symptoms. Instead, she was given a diagnosis of hysterical hypochondria and placed on antidepressants. When I initially saw this woman, she was upset, depressed, and thought she had some kind of progressive, disabling, yet to be diagnosed disease. This poor pain sufferer went through needless agony because no one could determine the real cause of her problems, and instead inferred that her problems, her symptoms, were psychosomatic. Without knowing the real cause of your symptoms, there's no way to effectively treat them. It's like shooting in the dark. Unfortunately, this leaves you with only one option: pain management. People often ask me, is it possible that many of my symptoms can be coming from just one cause? The answer is yes. Multiple symptoms can all come from one source. In 2002, I discovered two inherited abnormal foot structures that I suggest are a common cause of chronic muscle and joint pain. These two common foot structures, the Rothbart's foot and the preclinical clubfoot deformity, cause poor posture, which not only affects the joints and muscles, but also many other organs in the body. If you have one of these two foot structures, my therapy will correct your bad posture, which will in turn greatly reduce or eliminate the many symptoms associated with your chronic pain. There is no need to manage chronic muscle and joint pain when you can effectively treat the cause.